Hi, everyone. I have a lot of questions, but I know I'm limited to two, so I'm going to start with this report from Ernst & Young that came out in the fall and identified problems that needed to be fixed, and during phase one, outcomes were better. So can someone please explain what went wrong in November when supposedly changes were being made to ensure that long-term care was going to be better in the fall than it was in the spring?
I'll start by saying, we are learning as we go. And we know, of course, that this virus is transmitted through people. And it is very challenging for us to know when people are incubating the disease and when they can transmit it to others. As we have had more transmission in our communities, that's reflected in outbreaks in long-term care. That's the single most important factor, and we've seen that around the world. So there are many things that were done and many things that still need to be done. There are some of the issues that were identified that are not things that are going to be solved within a matter of months or weeks. They are longer-term issues that we are still dealing with and still struggling with. And yes, it is very much a challenge when we started to see dramatic increases in the community. That was reflected in outbreaks in long-term care. And tragically, that has meant that we have lost more of our seniors and elders. And that has been the overriding reason why our focus of immunization to start with is in those settings.
I think that's right. I think one of the things that we've noted and is noted in the report is that British Columbia has, and over the time of the pandemic, done better than other jurisdictions. But if you have a family member in long-term care, what happens in Ontario or Quebec or Alberta or Manitoba is of little relevance to you. I think actions have been taken to make significant improvements. But what's happened in November and December and now January in this second wave of COVID-19 is significantly more community transmission, and that reflects in long-term care. On Vancouver Island, we've had very few, I think less than a handful of people who've passed away in long-term care in all the care homes on Vancouver Island, which are putting in place the same measures, but there's significantly less community spread, and that affects healthcare workers less, and there's less outbreaks. So I think this has been true everywhere in the world, and every effort that we can make in long-term care, we're making. I know from throughout the pandemic, from having talked to families, from having talked to care workers on a regular basis, what it means. Because in addition to the cost, the people who've lost their lives and the impact of the outbreak on residents, on families and staff, we're coming up to March and a year, the first year after restrictions on visitations were put in place in long-term care, and some of those were lessened on June 28th of last year, but they're still in place, and so the consequences for people are significant. We're aware of that, and that's why those measures on visitation, the measures on single site, the measures on bringing PPE, bringing long-term care homes, which are generally responsible for their own PPE under their contracts in the contracted sector, into our supply chain. All of the efforts in infection control, the efforts in many care homes that have had outbreaks for health authority officials to go in and lead or help with the leadership of those care homes and the challenges they face. All of those things have occurred, and yet you're absolutely right. There have been significantly more outbreaks and more losses, and we continue to take those actions, and will continue to take the actions. One thing I want to emphasize finally, everywhere, is that while immunization is an important answer, people have to continue to dig in the healthcare sector, in every other sector, and in the community, that even when one is immunized, one has to continue to use PPE and to use protections and to support social distancing. This is a time, January, when there is spread of COVID-19 everywhere in the world and here in British Columbia, with the cases that we announced today, almost 500 a day, just slightly below. and we have to continue to take steps to reduce that transmission in order that those most vulnerable are kept safe.
So we've heard from the general public and business owners about, concerns with communication and clarity of public health orders. This report from Ernst & Young highlights communication issues contributing to a lack of clarity, confusion, and inconsistency. So what are you going to do to fix that?
Yeah, well, we've already been starting on that. I think we have to remember that the healthcare system, and we're talking about in this report, is complex. And long-term care has many different ways that it is delivered. We have private, we have public, we have health authority owned and operated, we have contracted, for-profit, not-for-profit. The whole history of how long-term care homes developed is complex. And when we put in, for example, the single site order, it was not universally accepted. And it took a lot of time and effort to understand the 95 different contracts that were involved with the thousands of people that were involved in multiple different facilities. So, it was confusing for people. It was challenging when some health authorities were farther ahead than others in doing this. And we know in the Lower Mainland, for example, where people often worked in facilities in either Fraser Health or Vancouver Coastal Health, we had a lot of challenges in helping owners and operators of facilities to understand who their staff were as well. There was a lot of complexity to it, and if you remember back last March, April, when we were going through this, it took us several months to even sort part of it out. So yes, it was confusing. It's still confusing. Things have been interpreted differently in different health authorities, and those messages go out to long-term care homes, to communities. How outbreaks are managed were slightly different in every health authority as well. We are trying very hard to come out with consistent provincial approaches. I meet with my colleagues very regularly to try and do that, but there are different ways of doing things in each health authority, and we are coming out with a higher level guidance from the province to try and address that. And we see that in the provincial visitation policy, the essential visitor policy, where we're trying to get consistency. But we have over 530 long-term care homes, and they are all operated by different entities, and it takes time for everybody to come along to a single way of thinking. And it has been a challenge. I don't know if you want to address that too.
I mean, I think that just to take two of the things that happened, the single site order, which affected directly the employment of 8,500 different healthcare workers, and in terms of remuneration, tens of thousands more. That's an indication of the challenge that was faced at the time of this pandemic, which is unprecedented in our lifetimes. And yes, there were challenges in that, but I think also people did exceptional things. I think the application of that order and the direction provided by Dr. Henry and provincial health officers and the supports by the healthcare system to that order were challenging and difficult here, and there were challenges in implementation here. It's beyond question that that's the case. They're also better here than other places because of the effort applied to them. Equally, with respect to PPE and its availability and supply chain, that happened sooner here. We took the approach, it was a Team BC approach involving everybody to try and achieve success in these quite complex initiatives that were taking place in the time of pandemic. And I think that the overall results in British Columbia compared to some other places, Ontario and Quebec and Manitoba and other places, which were dealing with similar conditions in the community, were good compared to them, but there are always challenges. I would say this, though, finally, that I think it's really to the credit of Dr. Henry, to our medical health officers and our team at the Ministry of Health and the health authorities, and all of the people working, including in the contracted sector and others, in terms of health orders in general, that I think we've made fewer changes than most other jurisdictions. We've stuck with orders consistently over time, including the present orders related to events and events both in the home, meaning only with your household, and events outside. There have been fewer changes elsewhere. Sometimes the orders have not been as severe as other places, but I think they've been followed more carefully because they've been delivered and held over time. And so what is unique and what is clear everywhere is that we have varied human activity everywhere. But the orders, I think, have been consistent. They haven't moved very much over time. And the current orders, for example, have stayed consistent since they were first put in place by Dr. Henry. And I think that consistency, along with the real contribution of people everywhere in BC, has made a difference here. Can we do better? Always, we can do better. But I think the consistency with Dr. Henry has viewed this, and her understanding that every decision has consequences for other things has greatly assisted us in this.
We've spent some time today talking about communication and long-term care, and one of the areas where it seems to have fallen in some sense to the wayside is around essential visitors. There seems to be an inconsistent application of that policy. Would you consider mandating long-term care homes in BC to give every resident an essential visitor?
So it is essentially a mandate that the guidelines need to be followed. And my assumption is, and I've made this clear, that everybody is entitled to have an essential visitor. We know that not everybody needs one. We know that not everybody has somebody who can play that role for them. But we need to err on the side of having somebody for every person. But we also know that it's risky, and as I said, there's over 500 different care homes that have different leadership, that have different ways of doing things. So coming to consistency is a challenge, and we are working on that by having very consistent guidelines and putting out those messages to people that this needs to be followed. And also there is a process, and I want people to know that there is a process that they can go through if they feel that they're being unfairly denied an essential visitor status. That involves going to the administrator in the facility. It involves going to the patient care quality office in the health authority where the facility is. It involves going to my office if need be. There's an escalation process, and people can also go to the office of the ombudsperson with their concerns. But we need to make sure that people have a process for being able to get an understanding of the essential visitor status. But it is something that is so hard for people. There's a lot of concern on both sides. Staff are concerned that the more people that come into the facility, the greater the risk. And we know that it's a hard balance to have quality of life for people in long-term care. And that's why our focus right now is on protecting people in care homes as best we can and making sure that those visits can happen.